approval of the agenda. Does anybody want to add anything to the agenda at this point? No, we got the agenda up there. All right, so now I was not at the last meeting. So Marina, you chaired that last meeting, I believe.
Yep.
And there's the review and approval of the minutes. So Marina, I'll let you handle that since I'm abstaining from that approval.
Sure. You know, the minutes are pretty self-explanatory, and as usual, I don't think we need to go through them, but if everyone has had a chance to look at them or wants a minute to take a look, and then I would take a motion to approve. Any questions about the minutes, or are we all good?
Good.
I think Eunice outdid herself on the minutes this time. They were awesome, absolutely awesome. So I make a motion to approve.
I second.
All right. All in favor of the minutes being approved and entered in the record?
Aye.
Aye. All right. Back to you, Chuck.
All right. Well, Mary Pat DiCarlo, I don't know if she's on, but when she comes on, we can let her talk about workforce strategies. In terms of the chair's report, primarily working with, you know, as I sit on the Connecticut Council for Developmental Disabilities. I'm now the vice chair of that council. The council is working through the bill 5001, which was passed. And part of the council's charges is to opine or give their position on certain aspects of it, including the major, what I believe to be the major change is to move from an ID or an IQ diagnosis for the threshold for services to more of a developmental disability threshold. Other states have taken on the DD Act definition, substantial functional limitations in 3 areas, a condition that manifested itself prior to age 22. And then the third tier, which I think some people overlook, is a lifelong need for integrated services and delivery of those services. So how that's all going to play out, I don't know. I assume the legislature is going to look at funding, budget impact, and also how other states are approaching it. Some use strictly the Developmental Disability Act criteria. Other states have sort of separated out IQ from autism, or certain IQ-based diagnoses from autism. Like Massachusetts has a specific autism, and I think they've expanded their Medicaid waivers in Massachusetts to cover a fair number of the autism population. So that's one area. They're asking us to feedback on part of the statute that deals with DDS and sort of a Bill of Rights for people with developmental disabilities. That's due December 1st of this year, by the way. So that's coming rather quickly. We're also working on the caregiver, paid caregivers, by the way. In other words, family caregivers, that the legal guardian and the family caregiver. I am of the opinion, and I'm going to send this out to Krista, they have been misinterpreting the Medicare, Medicaid rules, such that for older people, for older children, I should say, where the parent or the legal guardian is providing care, it says specifically, I mean, this is not me making it up. It says specifically in their instructional manual that it does not apply to older children, older adults, 18 and above. What it really applies to is legally responsible parents rendering care, and they're not permitted to get paid because you have a legal responsibility to raise your kids under the age of 18. So we're looking at changing that particular part of the Medicaid waiver. The key thing is all about all the other states when they're talking about it and they want to expand this. They talk about guardrails. What's the guardrail? How, et cetera, et cetera. I would suggest the guardrails already in place, and they call them case managers. Because case manager, and Shannon, you could talk to this, but case managers are supposed, I assume, are supposed to make sure that the care that the person's rendering is being delivered by people who are competent and adequate in providing the care to which they're entitled versus incompetent and inadequate, right? So I would say there's already a guardrail in place, but that's what their main issue is, about guardrails. They keep talking about how are we going to make sure it's not abused. I'm like, well, you already have a system in place. So there's that aspect. There's two other areas that are slipping my mind because I'm not involved in those two areas particularly, that the council's been drawn up on. So that's basically my report. Any questions on all that activity at the sort of the state legislature level?
Chuck, you probably know more about this than I do, but I understand that that's going to be going out for public comment in terms of family caregivers.
Yes. Yeah. There's going to be there has to be a there has to be a rule. Then it has to go out for public comment. Then they have to adopt the rule. Then CMS has to approve it for the amendment. And right now it's the DDS waivers that it's being applied to, not the CFC part of it, because it's in the statute. It talks about DDS. Once again, I'm going to raise with Krista that I believe you already can get paid as a legal guardian / family member for an adult child over the age of, I'll say 22. Let's make it simple, because it says it right there in the manual that it doesn't apply to adults. It only applies to those legally responsible. The issue becomes, is there a legal responsibility or financial responsibility, I would say, on a part of a legal guardian for an adult child? And there isn't. I mean, once you hit 18, that's the old drop them off at the emergency room and say, I'm done. I can't take care of them anymore. Good luck. God
Isn't
bless.
that
Kind
what
of
we've
thing.
been asking for, Chuck? Isn't that for your adult child and my adult child, where we couldn't get, appropriate help? We were asking if we had to, I don't know, to go part-time or something to take care of our kids, could you be compensated for that? And the answer was always no, unless you gave up guardianship. I don't know if it's correct or not, but that's what I was told.
Yes, that is correct. You've always been told no. I believe they're misinterpreting the rule, but that's just me. I mean, I don't have any force of law here.
Well,
But
I like what you're
but
saying.
we are
I
working to
agree
change
with
that. We are working to change that. That is that a family caregiver, whether legal guardian or not, a parental caregiver, whether legal guardian or not, can be compensated, especially in terms of a caregiving crisis, et cetera, so that they could actually be compensated. And remember, if the person lives in your house and you're paid, that is tax-free. That is tax-free income, by the way. And not only is it tax-free income, because the child is paying you. Like my daughter is actually the employer of her mother, because her mother gave up legal guardianship. So because she employs her mother, and I'm the support person, that's all I do. I'm not the employer of record. There's no FICA taken out of that paycheck either. So no federal withholding and no FICA in those circumstances. I'm not saying that's a good or bad thing necessarily, but the tax-free income is good, by the way. FICA, well, some people may want to put into Social Security. Other people may not. As long as they save the money, then they can do the same. They can accomplish pretty much the same thing by investing it. But there are other benefits to being paid as a caregiver under the Internal Revenue Code, specifically the tax-free income part. Right? So that's what we're working on. And Krista is going to be coming out with the public comment soon. We had a meeting. Walter Glom, Krista, and I had a meeting discussing that and the input. So that concludes the chair's report. Right. On to our esteemed director.
Oh, thank you. Good evening, everybody. I'm hoping Mary Pat DiCarlo can join us. We talked about her new involvement in DDS. She worked for the private sector for many years, and Jordan has retained her as the workforce development staff. Her focus is going to be on how we're going to secure staffing. She's been doing a lot of meeting with different groups, meeting with parents, meeting with just a variety of stakeholders to get feedback and information. She's actually, I believe, on a workforce meeting right now. That's why she's delayed in joining us, and hopefully she'll be able to meet with us. I think some of you may have known her. She worked for IPP, which is now Aspire, and Kennedy Collective, which I think, Gil, you probably know Mary Pat. So I'm hoping that she'll be able to sign on. If not, we'll bring her on another time. So I don't have a lot of news from since our last meeting. I did want to just give an update on the caregiver initiative, which we are no longer calling it the elderly caregiver initiative. Some people found that offensive, so it's now the caregiver initiative. It's currently opened up to parents and caregivers that are 65 and older. In the West region, this region, we have 219 people on the list. As of this morning, I checked our status. We have, let me see, approximately 5 people out of 219 that have expressed interest, have gone through Pratt, have worked with their case manager. So I'm a little concerned about that because that's a pretty big number that people aren't seeking the benefits that they can get from the caregiver initiative. So I'm going to be pushing a little bit harder on our case managers to make sure that the families are fully informed of this opportunity. So even if it's bringing in-home supports in, I did hear some of the feedback, and Karen, you'll attest to this. Again, it's about agencies and getting staff. So they may be interested, but there's nobody in their area, or there's no group home available in their particular area. So I want to get to the bottom of that a little bit more on what's going on. But that's a big number for us in this region, 219 people. Last year, it seemed like there was more interest than this year. So I think we have to kind of pull that apart. We've had quite a few meetings on STEP, where we're looking to move people to less restrictive settings. Jordan has done a lot of open forums available to anybody who wants to join, as well as the region has done virtual office hours where people can just jump in and, if they have an idea or a thought or just want to listen to what's going on. So we completed all ours in the West region. Initially only started out with a handful, but the group got bigger, so that was great. Although it is, could be a time bomb. You really don't know, what's going to happen during those meetings. A social worker, just for example, called in from Norwalk Hospital with a crisis she was dealing with at the time and brought that forward. So you just have to be prepared for anything in those sessions. So that was interesting. As I said last time, case management positions in the West region are completely filled. We added an additional position to our helpline to hopefully deal with the workload in that division. So I was happy about that because it's a very busy unit with a lot going on. I see that Mary Pat joined us. Thank you, Mary Pat. I don't know if anybody has any questions. That's kind of what's going on right now. I gave you a lot of information at the last meeting because we hadn't met in a while. I did want to mention, Eunice, there is a council meeting coming up that you're waiting to get confirmation on. Is that correct?
Yes, and it might be pushed to December, but once central office lets me know, I will send out the email to this council because it's a joint meeting.
Okay. I don't know if anybody has any questions for me. Marina, we did
Yep.
get some additional information following up from the prior meeting on Medicaid.
Yeah.
And because we don't administer the program, I'm going to give you kind of a breakdown. But in terms of the details, I don't know if I will be able to give you the information you want, but we will find out.
Now, I think I got the answer, which is neither of the competing proposals ended up in the final bill. And so now there's a separate thing going on, which many of you may have seen emails from coming out of the ARC regarding raising the asset limits for, for Medicaid and for Social Security. So my question was, did A or B win? And the answer is neither. So at this moment, those numbers remain the same until, with hope, if there's enough advocacy, this separate thing might fly and that we could have the asset limits raised.
Okay, just some additional information. It's kind of a sidebar, but
Yeah.
somewhere, similar. So July 1st, 2024, the funeral benefit paid under TFA will increase from $1,350 to $1,800. They're also stating that, oh, I lost it again. Let's see. October 1st, 2024, Husky C income limit increasing to 105% of the federal poverty level. And I think that's just about it. That's all the information I was able to get, so.
Right. Hey, so thank you. That's great. And we'll hope, and if we should pass the word, if you see that email, the ARC passed it out and then other groups have been propagating it. I think, that's a really important thing to get done because those limits hurt all of us. So that's worth signing and passing on. On a separate note, you were saying, Shannon, that there was low participation on the caregiver piece. I know that the STEP programs have moved their mail flyers that they're sending out, and there's a big push to move them to email, to get texts and emails. I'm wondering if they have gathered enough that could be a decent venue for you also, sort of piggyback on that to get the word out about the program.
Certainly. And again, I'm going to push on case managers to make that connection with these families, because we know who they are. It's just making sure that connection and they know what the next step is to do. So my concern is waiting until the last minute, the end of the fiscal year, and carrying the money over could be problematic. And if this is not available next year. So I'm seeing, obviously the same people from the list last year. There's no movement. So either the family doesn't want it, and that's what I need to know, that reach out happened to determine, that in fact they're not interested. But the different options that are available doesn't have to be group home placement. There's so many other options that we could do.
Right.
So, but thank you for that feedback.
So I'm just going to add a thing that came out of our RAC meeting that if you guys don't know about it, and I know that it's sort of tangential to what you're saying, but I'm putting in the chat a link to, on the DDS website, they've linked to a program called Rewarding Work. And so anybody who doesn't yet know about it, it's basically an employment site to put people together with people who might want to be doing. So if you're doing either private hire, self-direction, that problem that we're always talking about every single meeting of, I just can't find the staff. It's not about the programs, it's not about the day programs, but if you are doing an in-home support kind of thing and hiring your own staff, this Rewarding Work website is meant to, as an employment site, essentially, to put parents or family members who need people together with people who are looking for that kind of work. So, and I just stuck the URL in the chat.
Karen, have you used Rewarding Work?
Let me get off my mic. No, I
Okay, I
haven't.
was just curious. Okay.
I haven't.
And
So
there's
just
a big
describe
push.
how I would go about doing that, though, because I really don't know.
Well, it's essentially, it's like lots of employment things where people who post jobs who need help, I need help, And then there's people who will post their employment
Like, it's like care.com?
similar, but it's specifically run by DDS for the DDS universe.
Okay. I
So
was using care.com because it was specifically ABA that I was looking at.
yeah, and care.com is for anything from a babysitter to a whatever,
Right,
but
everything.
so
Exactly.
um
And they did have ABA people on there, but if you know, DDS, I mean, I'll certainly look at that now that you
so
talked.
look at the site, because I think it's sort of a hidden secret. I'm not sure I'm not
Yeah.
sure it's been publicized well enough, and it really has just started. There was a big push by the person who's running it saying we've really got to get more families on there, especially because if people do go there interested in working and it's kind of dead and there's no opportunities there, they won't go there anymore. So it's just the usual, you know, you need to have a lot of people to get jobs and a lot of jobs to get people. So let's see if we can, you know, make it more successful. But the link that is in the chat will take you to the DDS portal to the site, which you need access to through your case manager.
Mm-hmm. Okay.
Mary Pat has her hand raised. I don't know if you want to take, I don't want to take over, Chuck, but do you want to introduce yourself?
Sure. My name is Mary Pat DiCarlo. I just wanted to add something about the rewarding works. I can wait to do my thing. The Rewarding Works website is being looked at very closely. Some people had reported that they were having some difficulty with it. So that is being worked on. So I just wanted to let people know that. And I'll wait until it's my turn.
Mm-hmm. Mary Pat, do I know you from IPP in Stratford?
I'm sorry, Karen. Sue had her hand raised. So.
Oh, I'm sorry. I was trying to recognize Mary Pat. I think I know her.
Uh-huh.
So
Okay,
Sue,
go
you
ahead.
had Sue.
Okay, my question for Shannon is, if the older caregivers don't take advantage now, is it possible to have the age limit lowered a little bit so that maybe people a year or two younger might be interested in doing that?
I can speak to what they did last time around. I think they started at like 70 and they dropped it all the way down, I believe, to, I want to say 62, if I'm not mistaken. So I think they will definitely consider widening the net if, you know, like I said, the 219 in the West region and just a handful have pursued it. So I don't think anybody wants to lapse the money. So I would imagine that Jordan and our deputy commissioner would definitely be looking to do that. And they did do that last year. So people could take advantage of it.
Thank you.
You're welcome.
All right, Karen. I'm sorry, Karen. Did you have a
No,
question?
it wasn't important. I was trying to see if this is the Mary Pat that I knew from IPPI in Stratford. And I adored her. And so congratulations to DDS to getting her, because you were awesome.
All right. Well, Mary Pat, it's all yours.
Okay. Well, thank you for that, Karen. Yeah, it's been a long time. So as I said, my name is Mary Pat DiCarlo. I have just recently come to work for DDS, actually just about 2 months ago. For all of my career, which is pretty long, I have been in the private sector. I've worked at several different private providers over the years in many different roles. I started out in direct care. I worked residential, I worked ICF, I worked day, you name it, I did it. And then I worked my way through, you know, management and administrative levels. And most recently, I was a vice president of adult services at the Kennedy Collective. I was broached by the commissioner with this opportunity to come on board at DDS to look at the workforce crisis that the private providers are facing right now. And my focus truly is on the private providers. I'm not, I mean, if things could be shared, it'll be shared, but my job is not to go out and try to find staff for the state. My job is to help providers get the staff they need to provide the services that everybody so needs at this point. So far I have found the position to be very interesting. It is different working on the state side. There's some things I had to learn that I just can't do, or things that I can do that I couldn't do before. I'm meeting with a lot of different organizations within the state. Connecticut has a lot of programs going on in regards to workforce development in a lot of different areas, but there is not any focus on the direct support professional role. And so that's my job, is to shine a light on the needs for direct support professionals. I am working with the Office of Workforce Strategies, the Department of Labor, and we're looking at different ways that we can look to engage underemployed or unemployed people and do training that they could then go and apply to a provider, and they would be fully trained as a DSP. The other thing we're focusing on is the Human Services Career Pipeline. Part of House Bill 5001, the legislature is calling for a career pathways for people to look at. And one of the things that I have found in doing my research is that the entry-level position for almost all human services is technically a DSP position. So if we train people for that, and then they can look to increase their training and maybe become a DSP2, but then look to which direction do they want to go in? Do they want to go into elder care? Or do they want to go into autism? Or do they want to go, into the medical side, and eventually go on to be a CNA or an LPN and get a certification? So that is the thing, the big thing that we're working on. One of the things I've also realized as a private provider and now on the state side is that we know the legislature put a lot of money into the DSP workforce in raising their starting wage. However, it's still not enough. It's not a living wage unless you're working 2.5 jobs as a DSP. But it's not the only reason people aren't becoming DSPs. They're not becoming DSPs, one, because they don't know about it, and we have to do some advertising. 2, they are not trained for the job. They're going into the jobs. Providers are so desperate right now to get people working that people are just kind of getting in there. And that they'll fail because they're not being trained properly. So we have to really work on the training. What does the training look like? The other thing that I'm very interested in looking at, and I met with an organization today down in Washington, D.C., where they're training people with disabilities, all types of disabilities, to work as DSPs. And I just think that is an area that we need to explore. And the people that have disabilities, could you imagine that, the compassion and whatnot that they would bring to their job? So that is, in a nutshell, what I'm working on in regards to workforce. I do have a couple other responsibilities, but it's not directly associated with the workforce, but that's what I'm working on. So if anybody has any stories I need to hear or any insight, information they want to share with me, please do so. I'll put my email in the chat.
All right, our esteemed director has her hand raised, so.
Just had a
Mhm.
couple questions for you, Mary Pat.
Yep.
I know at least of one agency that has a training academy, a fairly large one in the South region.
Yep.
And I was just curious if they've had more success because they have that training academy and how they recruit some of their employees. Have they had better success than other providers in terms of retention and getting people on board?
They have had some success. They have just recently received a contract from the state as part of Career Connect, which is the under the Office of Workforce Strategies. And they are working on training people, et cetera. So that Human Services Academy has the contract. They are being funded to provide this training to people that they weren't necessarily getting funded for before. And they've also, I've been in regular contact with them in conversations, and they may be expanding that academy to other areas of the state. So it won't be limited to just the South region. Well, they have a satellite in Bridgeport and they're Woodbridge, but they're also looking to team up with other providers so that that academy can happen in other areas of the state.
And what is the Office of Workforce Strategies? Is that a state office? Is it people from different state agencies on this this work group? Or
well, from what I understand right now, the initial group, they are employees of the Office of Workforce Strategies. It was a division, department, whatever, started by the governor. And they have been working for the last couple of years in different areas of workforce development. So anywhere from, technology to industries, healthcare. Funny part is that to them, healthcare was always was RNs, CNAs, et cetera. There was actually one of their employees that said to me, "What is a DSP? I don't know what a DSP is." So we had to really expand and talk about that definition. So they're all state employees working for this division.
and then I just had another question. There's been huge press on the paraprofessionals in the school systems and the teachers of recent because there's such a shortage. And I just find that very interesting compared to for years and years, we've struggled.
Well, I think I was just on a call at actually the Governor's Workforce Council, and there was a lot of discussion. There was actually a presentation from Commissioner Bry in regards to the childcare situation and how the lack of childcare, the lack of good childcare, is affecting the workforce tremendously. So whether that's affecting the paraprofessionals, whether that, the DSPs, a lot of the entry level positions, jobs in this state are affected by the fact that people don't have the proper childcare. For DSPs, we're always looking for second and third shift. There's not a lot of childcare centers open during second or third shift. So those are all things that are being looked at. And the childcare situation, along with living wages right now, are the two things that are weighing very heavy. And those things need to be looked at. Just the wages of the childcare workers. Well.
Thank you.
Mm-hmm.
All right, so,
I'm sorry, I should raise my hand. Are you
so I was
pulling
just gonna say,
from the
Mary Pat,
same?
does that,
Go ahead.
Karen, just 1 second. I just want to see,
Okay.
Mary Pat, does that conclude your presentation?
Yes. So I'm
Okay.
open for
Go ahead,
questions
Karen.
and ideas.
Okay.
Yeah.
I guess what she just brought up about the paras. Are we recruiting from the same areas as home health care, people for elderly, paraprofessionals, direct service providers? Everybody's in the same boat. Is there a particular place that you're focusing on differently than that to recruit?
Well, we're not, I'm not necessarily looking at the recruitment right now, because you're right, everybody's looking into the same pool, right? And as we know, the DSPs are jumping from agency to agency, or, they're working for 2 different agencies, 3 different agencies. So the pool is limited. I also found out today that Connecticut, what was the statistic that basically anybody who wants a job has a job in Connecticut right now,
Right.
for the most part. And so, well, what does that say? Where are we supposed to find these other people? So we have to start looking at ways of getting the high school kids interested in healthcare or being a direct support professional. We need to get to the tech schools. We need to be working more closely with the community colleges. And a focus needs to be put on, what it means to be a DSP and how you can have a career when you start as a DSP. I mean, I did, Shannon did. I mean, there are many of us that started out as direct care. And there are many people out there today that want to stay as a DSP, and they've been doing this for 25 years and they absolutely love it. So, but where are we going to find those people now?
Right. Right. I think the career path thing that you're talking about is really important, because most people don't see a career path. They see a job and that's it. And if they can go somewhere else and do the same job for more money, that's what they do. They don't see a career path for how can I become a professional at what I'm doing.
Right.
Almost like case management. I really like, in my area anyway, the case manager that I had, who I knew wasn't going to last long because she's phenomenal, but she was able to recruit some really good people and train them to take her job. And she's doing a really good job of that. And so I'm satisfied, and the people that, that had her, that did want to see her go, we're all satisfied with who we have for that reason. But all of those people that she hired have a goal above where they are. There's a pathway. And I think that's what's so missing with caregivers. Where do they go from here? If it's just a job or part-time or whatever, but some of them are young, out of college, and they're looking for, where can I take this? I just think they need something that's giving them hope that there's a career path for them.
Right. The other issue too, I mean, when you talk about like college grads, back in the day, a long time ago, we were all college grads that were starting out as DSPs, or we were in college. And the wage, though it was never great, I know for myself, I didn't have to worry about college loans the way most college kids have to worry about now, right? They can't afford to be a DSP and start paying off their loans. It's just not going to happen. So that's where it gets back into, what is the compensation? What is the rate? Most providers are doing pretty good with benefits and offering good benefits to people. There's no reimbursement for that wage that they need to hit. And so that's something that really still needs to be looked at. And the one thing that has happened in Washington is that they are working to, the Department of Labor in Washington is working to have a direct support professional. I forget how they worded it, but it's like its own category. like a CNA or an LPN. And so they will be able to keep data on those positions and what the earnings are and this and that. And I think eventually, once that is done, we'll be able to put more data out in front of legislators and whatnot and explain the situations.
Okay, Mary Pat, really appreciate your presentation.
No
Any
problem.
other any other final questions for Mary Pat? If not,
Mary
is
Pat,
there-
get on the Connecticut Special Needs Family website
Okay.
because every other post is either asking for somebody reliable to babysit after school, or I mean, there's just so much of that on that entire website about, you know, the needs for people. And some of the parents, their posts are darn right angry. Like, you know, they've interviewed all these people, they hired people, and the people never showed.
Mhm.
You know,
Yeah.
and I don't know, it must be a different time, because I know at that age, I never would have ghosted somebody that I agreed to work for. Never. At least I would have shown up. They don't even show up. They don't call. They don't do anything. They're just don't. They're done. And they
Yeah,
were
the providers are facing the same thing. You know, you
I
come
know.
in on a Monday and you have 20 new applications in this, you know, in the queue. And if you're lucky if you hire one out of that 20, because either they don't return calls or they don't show up for training. Yeah.
That's it. Okay.
So. All righty.
Okay, so is there any new or old business to bring in front of the council? Because I think we have a member of the public here, so if not, then Eunice, I believe we have an A. Ramirez on the line.
Yes, she's with CTFSN.
Okay, not quite sure of her first name, but would she like to talk?
Yes, Ramirez.
Hello, good afternoon. How are you? First name is Adriana. And no, I have just no, I think everything that Mary Pat said was very interesting, and there's a lot of things about workforce. And I agree, I know which social media you're talking about, network, special needs, and the role of DSP has been difficult because families are trying to self-determinate, but at the same time becoming a boss and trying to keep people. And if structured organizations are having trouble keeping DSPs, then the regular families are struggling even more, especially with everyone having the capacity of pay is always a thing, but I've heard in other meetings it's a entry, it's a stepping stone, where it's almost like it's a temporary job that people are using as a temporary stepping stone to something else. So and then hearing from self-advocates the impact that makes, particularly when their DSPs could be there for a year and you develop a relationship and you know them, they know you, they know your nuances, your intricacies, and then all of a sudden they're gone and you have to start from square one again. And it's very difficult for the families, and much more so for the individuals that connected with that particular DSP, because it's more than just assisting them. It's really helping them connect to the community and connect to their daily life and helping them in whatever process they need. So I know that's been hard, and everyone is looking for some way to offer some structure or some, I hate to say, enticement, or just an opportunity to show it as a viable position, so people have maybe pride or see it as something, as a career path potentially. And I think that I'm hearing more and more conversations about that, but it is also very much impacting individuals, not only the fact that they don't have someone, but they may have multiple people in and out, and the energy it takes for the family or the individuals themselves to connect, to get through routines, to get things, to understand them, and then having that roller coaster of starting over each time.
Thank you. I'm going to tell you a quick story of how we got our aid. By the way, believe it or not, about 3 years ago, maybe 3.5 years ago, of all things, our current aide, who by the way has been a blessing, works really well with my daughter, takes her out in the community. He's really integrated into her family, the whole bit. Believe it or not, it was a result of an Instacart order. So she delivered the Instacart order. She noticed Gabriella, my daughter, and she said, "Oh, I work with," she just happened to mention that she also worked with it. Next thing you know, she's hired, and it's now 3 years later. So just
Wow.
just sort of kismet, so to speak. Yeah, just kind of like out of the blue. Now the other aide, by the way, came from care.com. She's sort of a weekend aide. And she's actually a teacher. She also teaches. And interesting, between the two aides, Gabriella would say the teacher is her favorite aide. However, Gabriella it clearly has integrated into the other family, and she doesn't treat the teacher as well as the other aide. The other aide is a mom, by the way, and Gabriella will listen to her and do a lot of things that she won't do with mom and dad. But it's just the weirdest or strangest place you can find somebody to take care of your child. It's just odd. But anyway, just thought I'd share that
That's a
quick
great
little-
story. Great story.
Yeah, I mean, just
But
you can
Chuck,
find
how
anybody
have
in any
you been able-
place.
How have you been able to keep them? Are you getting them raises? Because Pratt is
Yeah,
not
so what we
really
do,
open to that.
yeah, we keep going back to the case manager, and we've given her regular raises along the way. By the way, she not only has her aide, well, she has Taya is her aide. Taya is married to Kaiwan. Kaiwan now works out with Gabby Kaiwan's a professional trainer. And so Kaiwan is now taking Gabby under his wing. And she does 2 training sessions a week with Kaiwan.
Wow.
Yeah. I mean, it's just been a blessing. I mean, we just, stumbled into it. I mean, clearly stumbled into it. It wasn't like some grand design recruiting strategy. We're going to do this and we want these people and that, et cetera, et cetera. Whereas the other person on the care.com, she's a wonderful woman, by the way. The other aide, wonderful woman. Gabby just doesn't really listen to her. So just interesting where you can find, and that's what I tell people is you got to think outside the box sometimes and just ask everybody. It's just like any type of networking, right? If you want to network somewhere, you just keep asking people, do you know about an opening? I'm looking for work. I'm looking for this type of position. You just got to keep networking, and hopefully you find the right fit. Anyway, I will conclude my remarks. Anything else for anybody? If not, we can move to an adjournment, but anything else?
No.
Hearing nothing? All right. I shall make a motion to adjourn the meeting. Do I have a second? All right, Marina
I
and
second.
Sue and Karen,
And Karen.
everybody's seconding, like, let's get out of here, Gil. Everyone, let's go. All right,
Okay.
all in favor? Aye.
Aye.
All right.
Yeah, good luck,
All
Mary
right,
Pat.
everyone, you have a, yes, thank you. Appreciate your
right.
time. All
Bye-bye,
right,
Thank you.
bye now.
Bye-bye.
Bye.